Good morning, and I call this public hearing of the Senate Communications and Technology Committee and the Senate Health and Human Services Committee to order. And today's hearing is intended to receive answers from the Department of Health on an emergency procurement for COVID-19 contact tracing. On June 23rd, the Department of General Services approved a request from the Department of Health for a year-long $34 million contract with Public Consulting Group through an emergency procurement. Emergency procurements allow state agencies to sidestep typical bidding practices to obtain supplies or services quickly in an emergency. Our colleagues in the House State Government Committee, led by Representative Jason Ortitai, explored this very issue yesterday during a public hearing. As we learned yesterday, the emergency procurement process has been used more in the last 16 months than ever before. The emergency procurement process was used last July to hire Insight Global, and the contract with Insight Global recently ended for failure to secure personal information collected throughout the contact tracing process. The contract was estimated to cost $25 million. In May, we attempted to hear from the Department of Health on this data breach in order to get answers on behalf of the over 72,000 Pennsylvanians who had their very personal healthcare data posted to publicly accessible websites. The department refused to attend this hearing due to pending litigation, which I know Acting Secretary Beam will address in just a few minutes. But make no mistake, many of us on both sides of the aisle have very serious concerns about the transparency of the entire emergency procurement process. Although the new emergency procurement contract has not been finalized, we have not seen any other emergency procurement approval requests on the Department of General Services website, leading many to believe that Public Consulting Group will likely be the winning bid. Therefore, these committees are holding this oversight hearing to answer these pressing questions and see what changes have been made to rectify the wrongs of the contact tracing program. However, if we do not receive adequate answers today, then the General Assembly must course correct these issues moving forward. And with that, I would like to turn it over to my colleague, Senator Brooks, for her opening comments. Senator Brooks.
Thank you, Senator Phillips-Hill, and I completely agree with your thoughts and comments and will not repeat them. But I think that it is important to say, according to the article, Pennsylvania requested approximately $340 million in emergency contracts in 2020, with very little oversight, very little transparency, and very little accountability. And I think that is an important part of today's hearing, is how do we move forward from here to ensure that Pennsylvanians are seeing transparency in these contracts. And I do want to make it very clear that that $340 million is not entirely within the Department of Health, as we are talking with today, but wanted to bring attention to the gravity and seriousness of the conversation and the significant amount of dollars that we are talking about today. So I look forward to hearing from the department and hearing their ideas of how we can move forward in a more accountable and transparent way in the future. Thank you.
Thank you, Senator Brooks. And I'd like to turn to Democratic Chairwoman Committa for opening remarks.
Thank you very much, Madam Chair. And thank you to you, Senator Phillips-Hill, Senator Kaine, Senator Brooks, and Senator Haywood for organizing this hearing with the Department of Health to discuss COVID-19 contact tracing and emergency procurement of PCG. While Pennsylvania is fortunate enough to be one of the top states for vaccination rates, thank you to Governor Wolf, to Department of Health Secretary Allison Beam, and to our bipartisan COVID-19 vaccine task force for all your hard work. We are still amid a pandemic, and the need for contact tracing is still urgent, as it is important to the overall health and well-being of our Commonwealth. So I also look forward to hearing the testimony from the Department of Health on this very important and timely matter. Thank you.
Thank you, Senator Comita. And now I'd like to turn it over to our Senate Communications and Technology Democratic Chairman, Senator John Kane. Senator Kane.
Thank you, Majority Chair. Good morning, everyone. And I want to thank the Majority Chair of the Communication and Technology Committee, Senator Kristen Phillips-Hill, and the Majority and Minority Chairs of the Health and Human Services Committee, Senator Brooks and Senator Haywood, for the work in organizing this hearing, and to all of our testifiers, including Acting Health Secretary Allison Beam, for joining us today. We're here to learn about the Department of Health's new emergency procurement, or PCG, for Pennsylvania's contract tracing. This hearing is timely. Last week, the average number of daily COVID cases increased by almost 150% from 2 weeks ago. Over 80% of the new COVID cases are the new, more contagious Delta variant. Even the private sector is responding. Just 2 days ago, the Dow dropped 700 points, its worst single-day decline in 2021 over the Delta variant fears. The threat of COVID-19 is still very much real. Unfortunately, overall case numbers in Pennsylvania are down, especially among vaccinated individuals. And I want to especially commend Governor Wolf, Acting Secretary Beam, and the bipartisan legislature's COVID-19 vaccination task force, including our two Senate colleagues, Senator Art Haywood and Senator Ryan Allman, for their work in making Pennsylvania the 6th highest state in the entire country for vaccinations. And right now, the conditions are good for effectively utilizing contact tracking to prevent a more serious outbreak. We're seeing hundreds of new cases per day, rather than thousands like we were a few months ago. That means our caseloads are manageable, and contractors have the ability to contact folks when there has been exposure to encourage them to take precautions to prevent an outbreak. And the bottom line is that the contract tracking will save lives. We could talk about the cost of this contract, but when we talk about its effective, I want to make sure everyone recognizes that we are talking about saving people from dying of COVID. That's especially important for our children under 12 who don't have vaccines authorizations yet, and who will be returning to school in just a few months. As the threat of COVID-19 decreases, we can also reduce our need for contact tracking, which will ultimately make this contract cheaper. But right now, this contract tracking program is essential to getting us back to normal. Thank you again for the chairs for organizing today's hearing, and I look forward to the testimony. Thank you.
Thank you, Senator Kane. And we'll now hear from Acting Secretary Allison Beam from the Department of Health and Executive Deputy Secretary Kira Kleinpeter. And we are going to swear you in, so if you would, please raise your right hand. Do you swear to tell the truth, the whole truth, and nothing but the truth, so help you God?
I do.
Thank you. And I'll turn it over to the department for your testimony and then follow up with questions from members.
Great. Thank you so much. And good morning, chairs Brooks, Phillips-Hill, Kane, and members of the Senate Health and Human Services Committee and the Senate Communications and Technology Committee. I As Senator Phillips-Hill mentioned, I'm Allison Beam, Acting Secretary of Health. Alongside me is Executive Deputy Secretary Kira Klein-Peter. Thank you for holding today's hearing. As a matter of public trust, the department takes the safety and the security of individuals' personal information very seriously. Contact tracing is one aspect of our measures for disease prevention and control within the department. As a tool, contact tracing is more important now than ever, given the limited mitigation that's currently in place and the threat of the Delta variant, while we do have the rising caseloads, as Senator Kane mentioned. Through our oversight, we are taking steps to earn Pennsylvanians' trust. Part of that trust is holding responsible parties accountable through the judicial system. We realize that it may be frustrating that certain responses in this hearing have to be curtailed given active litigation. But we're grateful that Chairwoman Phillips-Hill has acknowledged the greatest good that we can do for Pennsylvanians is prevail on holding these entities accountable in court. And to ensure that the department prevails on our strong legal arguments, we may have to demur at times during this hearing. We deeply appreciate your understanding, and specifically Chairwoman Phillips-Hill's understanding that when litigation previously prevented us from actually participating in the hearing, and we hope to have cooperation today on certain responses. So putting that aside and getting into the substance, we hope to be able to provide as much depth as possible and be responsive to each of your questions on our contact tracing procurements to date. I will allow our comments to remain brief so that we do have adequate time for question and answer, but we wanted to be primarily hitting on 4 areas prior to Q&A. First, I wanted to offer a brief explanation of the contact tracing process. Second, to offer why contact tracing is so important for public health. Third, to offer a timeline of the Insight Global data incident. And finally, to offer a transition timeline, explaining where we see ourselves moving forward and being able to provide these supports and services for our constituents. So first, a brief explanation of the contact tracing process. When an individual actually tests positive, and in this instance we'll talk about just COVID-19, but we do contact trace for various diseases, a Department of Health public health professional reaches out to perform a case investigation. The case investigation is a 30 to 60-minute phone call, which first checks on that patient's well-being, and secondarily speaks through identifying any of the potential contacts that that person may have had where they could have exposed someone to COVID-19. Our trained contact tracers then reach out to each of those close contacts and inform them of their exposure. But we do not inform them of the identity of the individual that actually named them. Additionally, we step through any steps that the individual should take for quarantining. And finally, we step through our process for checking on symptoms for that individual and the potential for them to develop while they're in quarantine. All of this information is kept confidential. Another tool in this process is our COVID Alert PA app. This helps to alert those who the COVID-19 positive individual may have come in contact with, but may not have contact information for giving to that case investigator. For example, this app actually helped in my own family's instance where an individual was in a church pew and they didn't know that the individual in another church pew in front of them was actually also had the app, and that's how they were contacted by way of being able to make that identification without necessarily having the contact information for that individual. To be clear, the COVID Alert PA app was not part of this data incident and remains uncompromised to date. So why is contact tracing so important? 2 factors of COVID-19 underscore the importance of contact tracing. First, the ease of which the virus spreads through the respiratory transmission, and second, the frequency of that asymptomatic infection. For each person with diagnosed with COVID-19 who stays in isolation, an estimated 2 to 10 additional cases are prevented from taking place. As we progress into the fall, and as previously mentioned, as we are experiencing case count increases right now, We know that there will be children going back to school who cannot be vaccinated at this time. Likewise, we know that individuals will probably move their activities indoors, and all of this really heightens the importance of our contact tracing as a tool in the public health toolbox to be able to combat the spread of this disease in Pennsylvania. So third, we wanted to be able to provide a factual timeline of the Insight Global Data incident so that we all have a shared understanding of the Department of Health's role in that. As previously mentioned, at the end of July of 2020, the department entered into a contract with Insight Global for contact tracing. In the beginning of April, on April 7th, there was an outreach to the governor's office whereby no detail was provided, but there was an indication that there may have been a data incident with Insight Global. On April 8th, we were able to hear from Insight Global directly that they believed at that point any potential data incident was remedied. By April 20th, the week of April 20th, the Department of Health became aware that certain employees of Insight Global disregarded security protocols and established unauthorized documents created outside of state systems. Please note that no Commonwealth IT systems or assets, including the COVID Alert PA app, were involved or compromised in this data incident. Insight Global engaged a third-party IT specialist to immediately begin a forensics investigation to identify all individuals who may be impacted. On April 30th, Insight Global opened a toll-free hotline whereby any concerned individual could call and understand better if they were implicated, but also receive free credit monitoring, even though no financial information was ever included in any data incident. By May 20th, Insight Global began notifying approximately 76,000 Pennsylvanians who may have been impacted by this data incident. Also on May 20th, the Department of Health notified Insight Global that there would be termination for cause of the contract effective June 18th, 2021. And finally, as of June 7th, 2021, we as a department transitioned our contact tracing services over to the Pennsylvania National Guard to serve as a bridge until we were able to transition in an additional vendor. So now to that new vendor, as previously mentioned, we are working on constructing an outside entity working for 1 year with 2 3-year optional extensions on a contract to help support our contact tracing services. Please note that at the end of that period, the end of that 18-month period, we have all intentions of being able to bring these services back in-house with the Department of Health as they were previously. The cost of the services, based on current case counts, is roughly $9 million. However, we prudently prepared with a maximum ceiling in this contract of $34 million. We want to make sure that the contractor that we onboard not only has demonstrated success in other states in being able to scale up contact tracing services appropriately and aligned with any of our COVID-19 case counts, but also scale down those services if our Commonwealth is able to prevail on really being able to contain the spread of COVID-19 this fall and into the winter. The vendor that we selected was also already on the Commonwealth's invitation to qualify list, the ITQ list, which means that they had already agreed to the Commonwealth's terms and conditions. The vendor that we selected also agreed to safeguards regarding information security, contractor responsibilities, HIPAA compliance, and data privacy. And this vendor actually has demonstrated experience with an existing state agency. Ultimately, those factors allowed us to swiftly transition those services from the National Guard to this new vendor throughout the month of July. We will be continuing that transition into August as well. Again, being able to scale up as we have any potential case increases this fall, with students coming back into school, with folks moving their activities indoors. And so while we will continue to, as mentioned throughout this morning, continue to vaccinate as many Pennsylvanians as possible to prevent against any of those potential case count increases, we have prudently prepared and have this service available to us for the next 18 months to be able to be responsive. Prudent public health would dictate that we should be prepared for really what is a worst case scenario, and hopefully we don't have to invoke that maximum ceiling. And with that, we welcome any questions on the process by which we've onboarded these folks, contact tracing broadly, or anything that you all might want to bring up. Thank you so much for having us.
Thank you very much. And I would like to recognize Senator Judy Ward for questions.
Thank you. Thank you both for being with us today as we gather more information about the process. And I believe there seems to be a lot of questions about it. So the Department of Health entered into an emergency procurement contract with an Atlanta-based firm, Insight Global, to conduct a third-party contact tracing. Secretary Beam, prior to this role, you served in the role where you would be advising the department on entities that should be selected for emergency procurement. As we learned at the House hearing yesterday, that emergency procurement process is an internal review process within each agency. Can you walk us through the internal process to select Insight Global rather than any other entity? And can you tell me if the governor or department had a list of other potential contact tracing vendors?
Sure. So, Senator, I want to be very forthright in that many times the emergency procurement process is actually initiated within the agency, within a program area. And so, serving in the previous capacity of the governor's office, I wouldn't have been as closely informed about that process happening within the agency. Happy to go through what we have right now by way of protocol, what would happen by way of a program area initiating an emergency procurement, how they perform the right due diligence to make sure that they are selecting the right vendor and moving forward. I don't want to presuppose that that is exactly what had happened with the Insight Global contract last summer, but I'm happy to talk through our current processes.
Sure.
Great. And so I actually am going to allow Executive Deputy Secretary Klein-Peter, who just by way of background was yesterday's testifier at a hearing on emergency procurements and has that detail readily available. Thanks.
Sure. Thank you, Acting Secretary Beam. Thank you, Senator Ward, for the question. Can you hear me okay?
Sure.
Great. So as Acting Secretary Beam mentioned, often the need is identified within a program. And when we say program, it could be everything from, everything from the COVID team to our tobacco cessation team to any type of program area who is really executing good public health work. And so they determine that need based on data that is provided to us by outreach, often from all of you and your colleagues, or members of the general public, to identify that there is an issue that needs solved. In the instance of an emergency procurement, we determine that that need is so urgent that it cannot wait a matter of weeks or months to bring a remedy and a solution to it. So initially, program identifies that there's a need, and they lift that up to leadership. Leadership includes Acting Secretary Beam, myself, our Chief Counsel, our Deputy Chief Counsel, and our Procurement Director. Ultimately, we vet the initial idea that something is required for an emergency procurement, that it rises to that level. And recently we instituted a new policy within the department that the executive deputy provides written approval to the program area saying, yes, you may proceed with working through an emergency procurement. So we have an extraordinarily high bar within the department of what constitutes a true emergency procurement. After we provide that leadership level approval, the emergency procurement justification form is completed by by program and provided to procurement. This provides a rationale from a public health reason of why this is a true emergency. So we have to justify it to leadership, to the procurement office, and then ultimately that emergency justification form makes its way to the Department of General Services, who has the ultimate approval on whether something can proceed as an emergency procurement. I'm happy to walk you through some of the specifics with contact tracing, but happy to answer questions.
So was what kind of vetting, are you able to speak to what sort of vetting process there was with the Insight Global contract?
I cannot provide that level of specificity today for Insight Global, but I can talk about what we're doing now and moving forward.
Were there any, can you tell me if there were any Pennsylvania-based companies that had applied for the contract?
Yeah, sure. So by way of timing, so this was roughly May of 2020, and I know that there were multiple firms that had reached out, just as we had received on testing and other aspects of, I would say, pandemic response broadly through the governor's office. And I believe multiple firms were sent to the Department of Health to perform the vetting and understanding the characteristics of what we thought would be the firm that could respond best to the contact tracing needs. We are happy to provide what will likely be piecing together a little bit of history here for both of us in understanding what other firms were actually at all being contemplated, how the due diligence was performed to select Insight Global. But I don't believe it's fair for either of us to right now put forward the true selection measures for Insight Global. By the time that it had reached the governor's office, it came as a recommendation of the vendor with truly the justification to be able to meet the needs, primarily volume at that point. Pennsylvania's cases were increasing rapidly, as you remember, last May, and we were able to say, there's contact tracing calculators of how many staff and supervisors you would likely need to be responsive timely to the needs of each of these cases, and we needed to make sure that the vendor that we were bringing on could do that. And so I have a feeling that narrowed the field, but Senator, we're happy to follow up with if there were other contenders and why this one emerged as the leading.
Great. Thank you so much.
Absolutely.
Thank you, Senator Ward. I'd like to recognize Senator Brooks, followed by Senator Comita.
Thank you very much. Just a few questions, and then perhaps I'll follow up so that the other members have an opportunity to ask questions as well. But you had referenced that the current vendor has worked with another state agency. What are the similarities of the other state agency with the Department of Health to qualify this vendor? Since that was one of the criteria that was used to select this vendor.
Sure. So I will simplify it in saying that the existing engagement that the vendor has with a sister agency likewise deals with personally sensitive information and data, and they have kept and demonstrated the ability to remain prioritizing the security and the confidentiality of that information while working with the sister agency.
And I'm going to go back to a Pennsylvania-based company with now that the spread isn't occurring as rapidly as what it was. Did we not, as a state, have the ability perhaps to transition a little bit slower, take time, and perhaps vet some Pennsylvania-based vendors to keep it within the state of Pennsylvania?
So by way of time, just so folks understand the urgency by which we were bringing on another vendor. So we had already had the natural expiration of the contact tracing contract with Insight Global was going to be the end of July. We expedited that and termed it for cause in the middle of June. What we are preparing for, particularly with schools coming back in session, is that by mid-August or potentially beginning of September, when schools are back in session, we need to have that contact tracing workforce not only selected, but onboarded and trained to be able to provide the services to our schools, our school districts, our superintendents, and other entities that are having more indoor activities by that time frame. And so for us, being able to off-ramp Insight Global, maintain throughout the summer our timeliness of contact tracing, because it is incredibly important right now that even though case counts are low, we are on top of any potential outbreak before it becomes an outbreak, which really is a utility of contact tracing. But more than that, that we are fully staffed and prepared by the time the school year commences. And so for us, this has felt as if it exactly is a rapid onboarding. And the vetting of the companies, what we looked to first and foremost was we're at a different position than we were in May of 2020. At this point, contractors have the opportunity to have demonstrated success in other states. That wasn't necessarily true in May. So let's use that to our advantage. Show us where there are vendors that have actually executed and scaled properly and de-escalated when necessary, because that we felt like was such an important aspect of being able to, again, be responsive to the needs of Pennsylvanians for these next 18 months. Show us where it's been done right in other states. And so the vendor that we're ultimately onboarding actually has experience in 6 other states, and from public health professionals comes highly acclaimed. And so we were using that as one of our primary factors for consideration. With that, we did have other entities that we had factored, or that we had considered these factors for as well. I believe it was close to 8 to 10. 7. And so ultimately, I don't believe I know whether or not any of those are specifically Pennsylvania-based companies, but ultimately, for us, we needed to make sure that they were able to actually demonstrate success on board quickly, along with the other factors that we had mentioned. And that's what actually prevailed with selecting PCG.
With comparison to 6 other states, you had mentioned a range of 9 million to 34 million. With the other 6 states, did those contracts vary that significantly? And what is the difference between Pennsylvania's contract and the 6 other states, as well as the cost?
So I actually don't have the cost estimate of the other states that have contracted PCG for this purpose in front of me. But Senator Brooks, I'm happy to follow up with how Pennsylvania may be more, just by way of understanding scope and scale too. I want to take an opportunity to remind folks that in the world of public health, contact tracing is seen as such a fundamental tool that in a perfect world, we would have the expectation that not only can that case investigation happen within hours of a positive test coming back, but those contacts can be traced very, very quickly to really curtail any activity in the community, right? So that the individuals would not have any more potential for spread. Some of the public health entities have come together to help states estimate how large a workforce should be, given a case count and understanding how many people it would take to actually deliver on that timeliness. George Washington University really brought together a bunch of those stakeholders to say that our contact tracing workforce estimator for Pennsylvania at the case count level that we are at right now is roughly 2,225 contact tracers and 223 contact tracing supervisors. As you know, that is more than the community health nurses that we really are invoking right now to do our case investigations. And so I believe for us, it's also about striking that right balance, right? We have built this contract to allow us to scale if necessary, but we also understand the need for prudency by way of contact tracing and understanding that there is best public health practice, and then there's us being able to use these dollars as, I would say, as prudently as possible to be responsive to those needs timely. But I'm happy, Senator, to actually take this back and see if we're able to glean the other states' contracts volume. But I think that that's hopefully some helpful numbers and context for where public health would hold us to being able to be responsive in contact tracing.
I would like to get back, though, to the details of the contract. And I am interested in the difference between Pennsylvania's contract and the other states, what job duties they're performing in Pennsylvania versus the other states. If we're going to compare them with 6 other states, then I would like to see the similarities as well as the differences in the cost. To my understanding, perhaps our contract is higher than some of the other states. And so I would like to, see if that's accurate. And also, I would like to know, what are the benchmarks as far as the thresholds, and how will the decisions be made to increase those thresholds? What is the minimum versus moving up to the next step? Who is going to decide that? How is it going to be decided? Is it going to be, since it's going to be over a matter of time, will there be more transparency and discussion and conversation as to, hey, we think we need to take this contract to the next level?
So Senator, I can commit to, one, being able to get you whatever we can by way of state comparisons on contracts, both numerically, meaning the dollars, and also understanding if our substance differs at all in the roles and responsibilities. I think to your question about who is actually calling the shot on being able to ramp up the contact tracing efforts or bring them back down, that will clearly be done in consultation with our own leadership and our COVID-19 response team, as well as our public health nurses, in understanding what the timeliness is for being able to turn around that case investigation and quickly follow up with those contacts. I will offer that in the pandemic response, the team has also been prudent in understanding when contact tracing has to have priorities within it. And so when you're reaching 10, 11, 12,000 cases a day, the contact tracing associated with that is such a lift that rather what we did there was prioritize those that are in congregate care facilities so we could try and get on top of any potential outbreaks, and also those that involved schools and children. And we were able to make it more of a targeted tool rather than having every case contact trace. And so I think by way of best practices and actually our response to date, we've demonstrated an ability to know when we have to take our foot off the gas a bit with contact tracing and focus it in certain realms. But I think ultimately it will be our leadership team in consultation with clearly our COVID-19 response team, and happy to bring in the legislature in understanding better if there is an escalation of the contract, why it would need to be escalated and what's driving that decision.
Is BCG, is the only thing they're doing is contract tracing, or are they doing other things? Are they performing other duties? So
PCG is at this stage bringing on just a contact tracing workforce. We at this stage believe that our case investigations can still be performed by our clinicians in-house. We know our community health nurses have just been heroically working around the clock this entire response, but nonetheless, they do consider it their role to be able to continue maintaining the case investigation responsibilities within them and handing off contact tracing to PCG.
So they, is there any type of consulting, or is with the Boston Consulting Group, is there any other work that's being done outside of the scope of the contract?
So I just want to offer a clarifying statement, and I know that this is confusing at best. Boston Consulting Group, we've been able to work with on the vaccine rollout, and we have them under contract for working through our vaccine task force and supporting it. Public Consulting Group, PCG, is who we've brought on for purposes of the contact tracing. And so while Boston Consulting Group will continue to do vaccination, strategic thinking, and the consulting work that we had previously discussed, PCG will be in charge of all of our contact tracing.
Right, I'm moving on to Boston Consulting.
Okay, so Boston Consulting Group will not have any responsibilities within contact tracing. The contact tracing workforce will be.
I understand that. I'm moving on to that contract.
Great. And so the question is, what are they under consultation for?
What are they on under contract? We're talking about multitude contracts. We're talking about PCG. We're talking about Insight Global, and now I'm moving on to Boston Consulting.
Great. So
and the cost of that, because this isn't just about one contract. As I had mentioned in my opening statement, there's hundreds of millions of dollars of emergency contracts that are occurring, and not just within the Department of Health. And so there, in my opinion, there needs to be more transparency on these contracts and what they entail. So we have covered 3 contracts so far, and I'm moving on to the Boston Consulting contract. And I'd like to know, with that contract, what other work is being done outside of the scope of the contract with Boston Consulting Group?
Sure. And do you want to speak to eMarket, please?
Sure. Good morning, Senator Brooks. So I'll just step through. As you know, we brought BCG on to assist us with the vaccine rollout. They were integral in working with the vaccine task force and helping us to work through a lot of the data analytics that ended up underpinning our vaccine rollout. That contract was established with a PO of $11.6 million. We have subsequently contracted with BCG through an additional emergency procurement to assist us with a twofold analysis related to the resiliency of our healthcare infrastructure in Pennsylvania, as well as prudently spending the ARPA dollars that are coming into the department. Both of the details for those contracts are available on eMarketplace. Those are actually not required to be posted on eMarketplace because it's an emergency procurement, but nonetheless, under Secretary Topper's leadership, we do post those, so the details of them are available there.
I appreciate that. Not everyone in the general public can go on to eMarketplace. And I think this hearing is to have transparency to the public. And so I appreciate your explanation of that contract. So for those watching, we talked about Insight Global, that their contract went from roughly 22.9 million to perhaps over 50 million, to another contract with PCG from 9 million to 34 million, and then with Boston Consulting Group beginning at 11 million. All contracts done on an emergency basis. As things are starting to slow down with our trends, my question to you is the difference between an emergency contract and now with Boston Consulting, with the work that you're doing with them, can there be more transparency and more communication as to the job they're performing? And do you plan on increasing their contract?
Do you want me to speak to
We can
that?
tag team, yeah.
Great. So by way of more transparency and more accountability, I think Kira and I combined take significant responsibility for the federal dollars that are coming through the Department of Health. Senator, I think we've spoken before that the department, frankly, has never received the level of funding that it's currently receiving by way of federal grants. Our role in that is twofold. First, make sure that each dollar spent is strategic and smart for Pennsylvanians. Coming out of a pandemic, the needs are evident, and we want to make sure that we're doing that prudently. That's part of what BCG is being brought on for. Secondarily, it's the accountability part and the transparency part. We knew from the onset of many of the ARPA dollars that we would have the need to be able to be not only ourselves holding our program areas accountable, but also being able to be communicative with the general public of where these dollars are going, what they're investing in, what grantees are receiving them, and the like. And so we've created and really have a grant infrastructure now that we will be able to have that higher level of accountability for each of these dollars spent. I think with that, that's part and parcel with transparency. That's the information that then we're going to be able to share with you in a synthesized way of saying, here's what we received, here's the timeline on which it needs to be expended, and the parameters that are limiting how it can be expended, and here's what we're doing with it. And so we've gone into this with an intention of always having to be, I think, responsive to you and your colleagues in the General Assembly, as well as the governor's office on each of these dollars, and we take that responsibility significantly. And so that's part of where we've invested our effort, is actually doing the right infrastructure to handle the volume of dollars that is now coming to the Department of Health. Your final question is whether or not we anticipate BCG's contract growing further. At this time, there is no contemplation of it, and I think part of that is what Kira mentioned as well. We have now, I think, prioritized for our team a true shift in how an emergency procurement has to be justified, and really that it is going to be the rare exception with that right urgency behind it, frankly, lives are on the line, or if there is a circumstance outside of our control that's influencing the time frame of this. Those are our new threshold for having to justify our emergency procurements, which we then have to do with our sister agency at the Department of General Services. And so with that being said, I don't want to preclude saying that we could contract with BCG further, but I do believe that it would probably be through a competitive process rather than through any sort of emergency procurement at this time, given what we know at this time. But Kira, anything to offer that way?
Senator Brooks, just if I could share one more piece to your question with regard to how we be transparent and how we hold vendors accountable. And so I shared this yesterday, but I think it bears repeating here. The primary difference between a bid or an RFA, which are the, quote, typical procurement vehicles, and an emergency procurement is time. There is still a terms and conditions section. There is still a statement of work. There are still deliverables. And so in the instances of the contracts that we've talked about today, those are contracts that in several instances, Allison and I are Acting Secretary Beam and I are involved in on a day-to-day basis. And so we are holding vendors accountable for the deliverables that they have committed to. We don't treat vendors who come in through an emergency procurement differently than we treat vendors who come in through a traditional competitive process. Instead, we hold them to the same rigor and we exercise the same caliber of oversight that we would with any other vendor. And so the primary difference here is, again, time. And in the instance of a threat to public health, time equals lives. And so it has been our impetus and our objective to save as many Pennsylvanian lives as possible, which is why we've exercised the need to use emergency procurements. But they are held to the same standard and the same rigor is applied, regardless of how we end up contracting with them.
I think everyone here wants to save lives, and we understand the seriousness of that. Just to end with just one other question. When you mention accountability, actually two other quick questions. The accountability, did Boston Consulting Group, did they have anything to do with the proposal to eliminate locally family-owned pharmacies, community pharmacies from the vaccine rollout when they reduced providers, when you reduce providers?
So to be clear on BCG's role, they are an advisor, they are not a decision maker.
Did they advise you on that? Was that one of their?
So we went through modeling of what it would mean to contract our provider network. And in contracting a provider network, it's thinking through who is actually going to be able to receive vaccine. And in part of that contraction involved having us have, at that point, independent pharmacists were actually an explicit inclusion in the provider network. It was more about being able to create those points of access and drive the delivery into those communities. It was, again, they advised us on how to make sure that our provider network was going to meet that extremely high demand with such a limited supply, but they at no point advised us a specific specialty to be included or excluded. And again, I do want to own, I am the final decision maker on signing off on actually how those allocations of vaccines were handled throughout the Commonwealth.
Okay, thank you. My final question, and I hope you have this amount, is what is the total cost the Department of Health has in contracts for emergency procurement in 2020 and then 2021?
Excuse me for 1 second, Senator, I just have to flip to the right page. So since March of 2020, the department has leveraged 39 COVID-related emergency procurements. On those purchase orders have been the dollar value of $202,070,416. We have expended $88,054,711 of those dollars so far. With emergency procurements that we still have open and active, 93% of the dollars used were federal, and 99% of the dollars used on closed procurements were federal.
Thank you very much. Federal or state, They're all other people's money and tax dollars. So thank you very much for your time today and for being here.
Thank you, Chairwoman Brooks. If I could follow up on that, with regard to the original contract that was awarded for Insight Global was $22.9 million. General Assembly, to my knowledge, never appropriated those funds. How was the funding authorized, and where did the funding originate?
Absolutely. So in the spring of 2020, we were able to receive our first epidemiology and lab capacity grant from the federal government. I believe the initial one was in the 30 millions, and then it has been added to since. But those dollars were received from the federal government into an existing grant channel that had existed within the Department of Health prior to the pandemic, whereby the federal government gave us epidemiology and lab capacity funding for both testing and contact tracing, and those are the dollars that actually were funding the Insight Global contract.
Okay, very good. So over the weekend, Spotlight PA reported that the contract for Insight Global ballooned to $57.8 million, more than double the original cost of the contract, with a vendor that failed to properly safeguard sensitive health care information, and a contract that your agency terminated early. So help me understand how the cost can be even greater than the original amount, figuring that we did not run the contract for the full 12 months. Can you help me make sense of that?
Absolutely, and thank you for the opportunity to correct this too. The purchase order was increased to $57 million. That happened, I believe, earlier this spring, again, as a potential maximum ceiling. Invoices to date that have been paid to Insight Global is $28,660,923. And so at this point, Treasury has halted all other invoice payments to Insight Global in accordance with, I think, litigation. And we're going to be able to, again, I believe, curtail further payments. But at this stage, the $28 million is the actual number. And that was, again, contingent on this spring. The purchase order was increased, but we did not spend that much money.
Very good. Were there similar provisions? You spoke to the future contract having provisions to scale, either scale up or scale down, depending on case counts. Did the Insight Global contract have that same provision?
Yes, in concept, the same bringing staff on and then contemplating having to hopefully allow staff to be let go were contemplated in both contracts.
Very good. Thank you very much. I'd like to recognize Senator Comita, followed by Senator Ark.
Thank you, Madam Chair, and good morning, Acting Secretary Beam and Executive Deputy Secretary Klein-Peter. Thanks so much for being here today and helping us understand and answer questions. So a lot of my questions have been answered. So I'm going to move to protecting the security of data. So how is the Department of Health planning to enhance the security of data with this vendor, PCG?
Sure, I'll speak high level and then if you'd like to go into the provisions. So again, we have the terms and conditions that PCG would have agreed to by being on the ITQ list. But given the experience with Insight Global, then we have bolstered the data security and the ability to have the right governance, data governance and accountability built into this organization's expectation explicitly with us. Further, I believe there's also a management aspect of it from us as leadership that we were going to plan to hold the incoming vendor more accountable, making sure that they explicitly know that we are investing ourselves in abundant amount of time to make sure that this is not only a contract that allows for a smooth transition, but again, starts in on a long road of restoring Pennsylvanians' trust in this aspect of public health. And so with that, if there's detail you want to speak to. Okay, that's I believe what we're able to say about the forthcoming contract.
Thank you very much.
Sure.
Thank you, Senator Comita. Following up on those questions with regard to data privacy and data protection, I mean, obviously the Department of Health, we understand, is under active litigation with Insight Global. But I think we have to further explore it. A lot of sensitive information on individuals, COVID-19 diagnosis, their address, things like sexual orientation, and more. Adults, all the way down to children. As we all know, nothing that is submitted or shared electronically is ever fully deleted and is always recoverable. Can you extrapolate on the plan with this data long-term? Who has this data? Where does the data go? Who will have the data in the future? And what are you doing in this next contract with this data as well?
Sure. So just by way of doing a comparison between Insight Global and what we're foreseeing by way of PCG. So in the instance of Insight Global, staff were putting data in unauthorized systems. So again, different from data breaches or other.
When you say unauthorized systems per the contract or per the vendor?
I would say both. That there was a system being used by staff that was not necessarily condoned by the vendor, but absolutely was not a state system. And that was where they were storing personal information. And so when that was discovered, again, while this does not mean that there was any compromise to a state system, which we do have constructed, a secure state system to allow this contact tracing process to continue to take place without having that compromising data available on the web. The staff of Insight Global were treating that information differently in an unauthorized way under the contract. And so that is part of what we are currently in litigation with Insight Global on. But moving forward, the way we're preventing it is that PCG is again going to be bound to restricting all of that information to only our state systems. That there will not be that opportunity for unauthorized systems to be used. That frankly, the infrastructure that we have, which is secure, is going to be the sole place that that data is stored and maintained.
Thank you. Would like to recognize Senator Kane for questions. And we will follow with Senator Argyle after Senator Kane.
Sorry about that. Is it possible that COVID-19 mutates again and we see an even more aggressive variant in terms of infections and deaths than the current Delta variant?
Yes, that's possible.
That's what I'm expecting also. And how will contact tracking help prevent the spread of new variants?
Sure. And so variants naturally are going to be created in likely individuals that aren't vaccinated. And so as individuals that aren't vaccinated are mounting an immune response in that is how you get variants. And we've had variants throughout the COVID-19 response. As you mentioned, Senator, public health experts right now feel that Delta variant is the greatest threat to us continuing to normalize our societies again, given how highly contagious and transmissible it is. Contact tracing is a tool to really halt that transmissibility. What it allows individuals to do is first be empowered by knowledge that they potentially had an exposure to an individual that tested positive for COVID-19. and they can take any sort of precautions by way of symptom monitoring or getting tested so that they have a better education as to what their health status is. But secondarily, it allows them to change their actions. If they were going to go to an event with many people indoors, but they know that they have that potential exposure, again, they're armed with the information to curtail that activity, which prevents that further spread. And so contact tracing is this critical tool that really hinges on knowledge and the individual being able to be aware of their own symptoms and monitor their health more discreetly, but then also protect those around them by being cautious and, I would say, prudent in their activities and not necessarily being somebody who would then go and be the spreader of further disease.
If I could just add some data to that. So for every individual who stays in quarantine, 2 to 10 individuals, in isolation, 2 to 10 individuals are potentially prevented from becoming a case. And so that is really significant. If you think about what Acting Secretary Beam just shared, that information is power, and that a single person understanding that they could have been exposed, remaining in isolation, prevents 2 to 10 more cases. And so when we're talking about a highly virulent virus, that is something that is extraordinarily important.
Thank you. What other states are currently utilizing contact tracing? Do you know of any offhand?
So at this stage, the state health officials from all states and territories, so all 56 states and territories, are utilizing contact tracing. There was one state recently where there was a movement to curtail contact tracing. I believe that is what their public health department is proceeding with right now, but I wouldn't want to speak further without consulting with them.
Very good. I don't have any other questions. Thank you.
Thank you, Senator Kane. Senator Ament, followed by Senator Dush.
Thank you, Madam Chair, and I first want to commend the majority and minority chairs of the Communications and Technology Committee and the Health Committee for convening this important conversation today. The public disclosure, transparency of the procurements of emergency procurements in these contracts is vitally important. And so I appreciate the conversation, and Acting Secretary, appreciate your testimony here this morning. I want to open, before I ask a question about contact tracing and specifically the National Guard's role in contact tracing, I want to first just express my appreciation. Senator Kane earlier commented about the work of the COVID-19 vaccine task force, and it has been an incredibly rewarding experience to have been part of that task force and to have worked with the Secretary, the PEMA Director, and the Governor, and my legislative colleagues on that task force. But most importantly, want to acknowledge the work of our provider network and just the outstanding work that they have done over the last number of months to dramatically improve Pennsylvania's performance with respect to vaccine distribution, ensuring all Pennsylvanians who wish to be vaccinated have access to that vaccine. And throughout that process, there have been a number of partners, as you know, that the Commonwealth has worked with. Earlier, we had the conversation about the Boston Consulting Group, and certainly I think the importance of the questions that Senator Brooks asked, vitally important to understand the scope of that contract, the cost of that contract. I will tell you, at the outset of the Vaccine Task Force, I was skeptical of the Boston Consulting Group. Before I joined the task force, I had made public comments calling for outside expertise to be brought to the table, whether that be the military, whether that be private sector expertise, a vaccine czar, I think is how I termed it at the time. And the Boston Consulting Group was presented to me shortly after those conversations. And I think I recall saying, well, we'll all be, including the Boston Consulting Group, we'll all be measured by our performance. And I've seen the value that the Boston Consulting Group brought to those conversations, the analysis they provided to the task force to assist with the recommendations that we made to you and to the governor for for decisions. So certainly want to recognize, I think they have to be held accountable financially, but certainly the results in many respects speak for themselves. Another such partner was the Pennsylvania National Guard through the vaccine distribution process, and specifically as part of our initiative to ensure that educators had access to vaccines so that we could get school children back in school in person as quickly, as rapidly as possible. And I think the performance of the National Guard was outstanding. I heard directly from our educators, from the folks who were working at the intermediate units as part of that effort, and the feedback was tremendously positive with respect to the work of the Pennsylvania National Guard. What I'd like to ask about this morning is the role that the Pennsylvania National Guard has had assisting with contact tracing in Pennsylvania. My understanding is following the breach with the Insight Global contract, the Department of Health did partner with the Pennsylvania National Guard to assist with contact tracing. Can you describe that work? Does the National Guard have any role currently in our contact tracing program here in Pennsylvania? And do you foresee a future role for the Pennsylvania National Guard?
Sure. Senator, so thank you first for the time, the tireless dedication that you've put into the vaccine task force. I think it's a unique entity in how we've been able to work through truly challenging circumstances. Those were not easy meetings or discussions, and your leadership is greatly appreciated. I also just want to offer an opportunity to thank the provider network, as you did. We do not pretend to be vaccinators. We know that we have a critical partner in any Pennsylvanian getting vaccinated, which is the provider network who actually did the administration of the vaccine. And so we really do need to take a moment to pause and recognize them, because they have been working the tireless hours throughout the response, only to have added to their workload a vaccine rollout, which was hopefully once in a generation. With that being said, the use of the National Guard clearly has been critical in our response broadly. The vaccine example that you brought up is one. We have used them, and Kira is best situated to speak to, we have used them as a tremendous partner in our long-term care response and being able to assist with long-term care facilities as well. For purposes of the contact tracing role, as we went through the timeline of how quickly we were going to have to off-ramp Insight Global, given that we had determined that a termination for cause was necessary, we also knew that we were going to have to quickly on-ramp another vendor. But to make sure that we, again, allocated the proper due diligence to bringing in the right vendor, there would be a time period whereby we would need reinforcement from our community health nurses to have additional resources to help make sure that we could maintain our contact tracing services. This was always a concern of ours from the very top. How quickly can you offboard and then onboard an entity to help us with this when our case counts are what they are right now, and really if they had any potential for increasing, given that these decisions were being made right when we were lifting mitigation measures and masking. And so we were trying to do this with the potential to plan for what could be, given the mitigation measures being relaxed, while also making sure that we were not keeping a contractor on our rolls longer than necessary. And so when the decision was made to again terminate for cause mid-June, knowing that we were still in the process of onboarding PCG or the subsequent vendor at that point, we were able to actually again look to best practices of other states. And the National Guard had been used to reinforce contact tracing, which I forget the term of art, COVID mapping, is what the National Guard calls it in other states, to be able to reinforce what is an existing workforce's bench. And so what we knew was at that stage we had the ability to, I think, invoke a bit of National Guard support. We knew that it could not be our 18-month solution, but we knew that they were, again, a strong partner throughout our response and could truly help serve through this interim time period. They were trained and onboarded June 7th. They are currently helping our workforce be able to be responsive to, even with the case counts that we have right now, perform the contact tracing services, and they will be incrementally off-boarded as PCG is onboarded throughout the month of August. Any details I'm missing there?
So I think to Acting Secretary Beam's point, we started with roughly 50 service members doing COVID mapping. We currently have about 12. That was due to their order schedule and the like. 12 right now is sufficient. We are beyond grateful for their help in this important public health effort. And as Acting Secretary Beam said, we anticipate that that number will continue to decrease into the middle of August, at which time we anticipate PCG being fully onboarded.
Thank you, Senator Ament. Senator Dush, followed by, is next on our list, Senator Stefano. Senator Dush.
Thank you, Madam Chair, and thank you, Acting Secretary and Executive Secretary. First of all, I want to thank you for what you were talking about. I had questions about the Pennsylvania contractors being allowed to apply, but I'm also former Chief of Information Protection for the Pennsylvania Air National Guard. The fact that the criteria you outlined for establishing who was going to get the contract are the types of things that are critical to making sure that that identity, that information that belongs to the people, it doesn't belong to the government, it belongs to the people, remains secure. So I'm grateful for that. I do have a couple questions though. Going back, I'm going to continue along the lines with the Pennsylvania National Guard. How much has it cost the Guard for their participation? I'm very familiar with their capabilities and such, but I'm wondering month to month, how does it compare having the National Guard doing it as compared to what the contractors are going to cost us? Do you have that kind of a cost breakout?
So Senator, to the best of my understanding, the Guard is actually federally on federal orders at this time, and so the federal government is actually paying for them. I don't know right now, but we'd be happy to follow up with what that estimated monthly cost is. But right now, as they're on federal orders, the federal government is paying for them.
I appreciate, and I would appreciate having the information.
Absolutely.
Do you have any information professionals from the National Guard participating and helping as far as oversight of the contract as it's implemented? Again, I was Chief of Information Protection for the PA Air Guard. These people definitely understand the PII as well as the classified. Do you have any of those people who will be assisting as you onboard PCG?
We do not. Their role is really to execute the COVID mapping, not to provide oversight. That's really the department's responsibility.
Do you have any information professionals that are that have the same kind of credentials that would be able to do that?
I don't know if we have information security professionals with military experience, but we do have highly trained and skilled information security, not just an officer, but program staff.
Thank you. On June 23rd, when this contract was posted to eMarketplace, our case count was 174. On June 23rd, the case count's 510. That's roughly 3 times less than on the same date in 2020. Now, the initial contract was $22.9 million with the previous vendor. This is now looking at $34 million. I'm just curious what, with the case count being so much lower, why the need for the higher costs? What's the justification for that?
I'm happy to speak to the modeling that sits behind it. So I would offer that just today, we were closer to 600 cases. And so realizing that at the end of June, we were in a position to have case counts within the 100s, we also knew that there was likely going to be an increase in case counts, not just by way of people being more likely to travel, but also by the threat of the Delta variant. And so this is again built on the modeling that indicates that what we will likely encounter this fall when folks are back in schools or back indoors with their activities is a potential to have those cases increase again. That is the range, right? To have the 9 million really be more what we pragmatically anticipate being the cost, but we nonetheless prepared to have the 34 million ceiling be something that we could invoke if the circumstances really rose to that. But we are much more expecting closer to a $9 million cost associated with that year contract.
I kind of hope that it does. With the vaccination levels the Commonwealth has already achieved, as well as herd immunity as a result of active cases that occurred that people are surviving, the ability of the Delta variant to spread is significantly less than what the initial case without any vaccines and without people having already contracted the disease and developed a level of immunity already. So given that statistic, as well as the numbers that we're currently at, the ceiling really concerned me that we're looking at something potentially that high.
Senator, if I could offer, if we had 300 to 600 cases a day of measles or tuberculosis, our team would be, quite frankly, losing their minds. And so I think there's a phenomenon that's happened because we've all been living this pandemic for so long at this point to normalize the fact that there's 300 to 600 cases a day. But quite frankly, if we had told our epidemiology staff a year and a half ago that or our public health workforce, that they were gonna have to be dealing with 600 cases a day a year and a half later, I quite frankly think they would have all walked off the job. That is not actually normal. That is still significant. It is truly still a pandemic, particularly given how many people in the world are unvaccinated at this time. And I think it's prudent to continue to be prepared in the event that there is not just the Delta variant, but others. And as we learn more, that we're prepared for a potential worst case scenario.
I think I'm going to have some follow-up questions, but I want to write them out and frame them. Thank you.
Thank you, Senator Dash. Senator Stefano, followed by Senator Hutchinson.
Thank you, Madam Chairs. Thank you, Secretary, Deputy Secretary, for this transparent information that you're giving us today. I did want to touch on very quickly, as Chairman of Veteran Affairs and Emergency Preparedness, a big thank you to our men and women of the National Guard. They've done a yeoman's job of fulfilling all the needs that we've had across the Commonwealth. Without a doubt, they've always answered the call every time we've asked them. And here again, they are answering the call literally, doing the contact tracing between our last vendor, Insight Global, and of course, as we transition into PCG. So my first question for you then is, as we're transitioning between Insight through National Guard into PCG, how are we making sure that as we transition, that data is secure? Can you walk through that process a little bit and making to tell us exactly how it's being secured so everyone knows that it's safe?
Sure, I'll go high level and then Kira, if there's anything else I miss, happy to have it. So this harkens back to the beginning of the testimony where we talked about the state system that actually houses much of this data was not involved in any part of this data incident. That system has remained uncompromised throughout this response. That is the same system that the National Guard will then access, and that is the same system that PCG will access. It was an unauthorized use of data on an unauthorized system that actually wielded the data incident with Insight Global. And so with that, our system has remained secure. I think as Kira alluded to, our program staff, our data specialists, and frankly here in the Commonwealth, our chief information officers, our privacy officers, those that have all been lockstep with us throughout this response to what is a data incident within a vendor, have really done an unbelievable job in maintaining the security of the state system. And so in that, we will continue to make sure that any oncoming vendor knows that that is our top priority. We do not want any of our systems, our apps being part of a compromise, obviously. But more than that, it's also making sure that the incoming vendor knows that our expectations is that the unauthorized use of information as Insight Global conducted themselves is beyond unacceptable for us, which gets us back to where we're taking care of certain issues in litigation.
Excellent.
Not
Is there
to
any
put too fine a point on it, sir, but just to be really specific. So the state system that Acting Secretary Beam referred to is the CTMS, the Contact Tracing and Management System. That is our internal Department of Health system where we house all of the contact tracing data. And so it's simply a matter of having authorized users who have access to that system. So when Insight Global was performing contact tracing, they had access to that system and that database of information. Now that they are no longer doing contact tracing, they are not authorized users, and we have cut off all ability to access that system. So today, we have Guard members who have access to CTMS. When they transition off of this mission, we will bring on PCG onto that system. So it's really a matter of controlling the access points and who has access to the system. But as Acting Secretary Beam said, that system has always been secure. There's never been an issue with the security of that state-based system.
And these vendors that can access the CTMS system, can they offload the data? Or are there protections to keep that from happening? Because it sounds like that's what happened to Insight Global.
So my understanding is they are not able to download data from CTMS. I'm not sure that I can go into the specifics of what happened with Insight Global due to the litigation, but I can just say that the way Insight Global handled data was on an unauthorized system outside of that CTMS system, which was secure. And that was an unauthorized way to manage data.
I see. I'm just concerned they got the data somewhere and put it on an unauthorized system. I just want to make sure that doesn't happen again. And I'm sure everyone's watching. On a similar vein but different angle, when you selected PCG, were there any other Pennsylvania firms considered as you were looking into that contract?
So we have the firms that are actually were considered. What I don't believe we have is their headquartered state.
No, that's if they're a registered supplier in
Yeah,
Pennsylvania.
so that, if you don't mind, Senator, we'd like to get back to you with that to determine whether or not there were any other Pennsylvania headquartered firms in the running.
Okay, I would like to know who was overlooked and for what reason we didn't use a PA firm. The other question, since PCG does now have the contract, do they have any other contracts with state agencies across the Commonwealth?
Is the question, sir, does PCG have other?
Yes,
They do.
PCG.
Yes, PCG, Public Consulting Group, has a contract with the Department of Human Services.
Just one additional contract, and do we know what that amount is?
That is the one that I'm aware of. Before I say that's the only one, I'd like to have our team check that, and I'll be able to follow up with amount then too.
They are on our ITQ supplier list. So that's a list that's maintained by DGS of registered suppliers in Pennsylvania and those who we already have work with. And so it's easier for us to choose a vendor off of the ITQ list. And so PCG is on the ITQ list, and they were already a registered Pennsylvania supplier. But as Acting Secretary Beam said, we'll follow up with that additional detail.
I see that they have other contracts with states to our north and east, which typically throughout the pandemic we have been aligned with through the administration, New York, New Jersey, those other states. Other nearby states, our neighboring states, Ohio, West Virginia, Maryland, are they using similar contact tracing companies, or do they use different vendors? And does our COVID count match those other states, or are they more aligned to our northern and eastern states?
So through the Association of State and Territorial Health Officials, we were actually able to understand better what the landscape of contact tracing workforces were. That was part of our due diligence, and also using one of our epidemiologists who's actually a leader within the States Association, the Association of State Epidemiologists, CSTE, They also were able to talk about where states have not only brought on third-party vendors, but as we mentioned previously, the National Guard is used by other states as well. I would be happy to try and glean what they learned by way of 50 state surveys and where other states stand with using any sort of outside vendor or entities like the National Guard. I would offer that anecdotally, I believe that it is the majority of states that have had to bring on reinforcements to really bolster their contact tracing efforts. Again, just as we have the foresight to envision that hopefully these are services that are brought within the Department of Health and within our traditional workspace after this 18-month contract, contact tracing existed well before COVID-19 came around, and a lot of states were able to actually deliver those services through the existing workforce. And so I think knowing how strained public health workforces have been throughout this response, many states, if not a majority of states, have had to bolster this team in some way, shape, or form. But I'm happy to see what type of detail we can glean by way of who is contracting with whom and to what level of scale, and then to your, I think, ultimate question, which is how does that yield in their ability to control case counts?
Well, thank you for your information on that and your continued work. I hope that very soon that we won't need to be talking about these issues anymore. That's my ultimate goal. Thank you, Chairwoman, for your indulgence on my questions, and I look forward to continued testimony. Thank you.
Thank you, Senator Stefano. Senator Hutchinson, followed by Senator Robinson.
Thank you, Acting Secretary. Before I get to my question, I did want to just mention that I do agree with statements by Senator Brooks earlier about the critical place that local pharmacies play in the vaccination regime for our rural counties. And I'm just going to leave it at that, and then I'll go to my questions. And that my questions really center around the beginnings of this contract tracing process. When many of us saw red flags, we thought there's a lot of sensitive information here and a lot of personal information, and we were really concerned long before any breaches that this information was somehow going to fall into the public realm, into nefarious hands, and lo and behold, that's exactly what happened, unfortunately, and that's really unfortunate. But I guess I wanted to start by asking how informed are those who are being contract traced up front? How much information are they given up front saying, you know, that this is sensitive information we're asking of you? We are guaranteeing, obviously we can't 100% guarantee, but this information is going to be guarded by the state, sort of giving him a warning up front. And I'm going to ask you if that has occurred and does occur. Did it occur from the beginning or only in recent months after this breach occurred?
Sure. So on the contact tracing involvement and the interaction between the contact tracer and one of the contacts, the first thing is the identifying information is really used to make sure that you have the right person, right? That you make sure that the name checks out with who the case investigation actually said should be a close contact, the phone number and the address. Secondarily, the person is really speaking to that health of that contact. Have you had any of those symptoms? Do you need to go get tested right now? Is more about the well-being of the contact at that stage of the game. They may ask if the individual had already gone to get tested, because maybe they had experienced symptoms, they may ask that question, but that would be the information about really the well-being of the individual. And then the final piece is instructing any sort of procedures that may be necessary by way of quarantining. And so in that contact tracing experience, I do want to highlight that We do not have any financial information that is ever exchanged by way of our systems and the individual being contact traced. And we always want to make sure that they have the ability to know that, frankly, they don't have to participate in the contact tracing process. That is part of our script. And if you look, we do a contact tracing update on a monthly basis, and it's of course not our choice of path forward with some of these experiences, but it is the option of the person that is the contact, whether or not they truly answer the call and then participate in the contact tracing process. To get the exact verbiage so that you know what's up front disclosed to the individual, we're happy to share the script with you of our contact tracers. I will note previously we were, I think, more concerned about that contact tracing script being shared because what was happening in certain states is that nefarious individuals, as you put it, were using that contact tracing script, copycatting it, and frankly, plagiarizing it in a system of fraud, right? And we want to protect against that. But I think that will probably be the best way to answer your question, to know what disclosures are yielded up front for an individual so that they know that participation is voluntary, information that is held is confidential, and what information might be exchanged throughout the course of it, if that works for you, Senator.
I would appreciate having that. As I said, this is very personal stuff, and I don't want people to know, if I were one of those, about my health, my, how are you feeling? Obviously, those are important questions, but I don't want people to know all that stuff. I guess I'll drill down and ask about, because I have heard from young folks, those under age 18, students who may or may not take this as seriously as maybe should be. I guess I could apply to anybody, but I've heard from young folk about the way they answer, et cetera, and I guess first question is, how many under the age of 18 have been contacted and do you have a number for that, number of those under age 18?
I don't believe we have the number of age 18. I don't know if this helps. As of June 30th, 2021, our nurses reached out to 376,264 individuals to provide them with the isolation and the quarantine guidance and perform the case investigation. 152,943 completed the full interviews, 42,000 and change completed partial interviews, and 180,000 were not successfully reached after multiple attempts. What I can ask our team is whether or not we have an age bracket breakdown for those that actually complied with at least the full interview, if not the partial interview.
Again, I'm concerned that maybe they didn't take things seriously, answered incorrectly, and even if there were follow-up after the breach, that they may or may not take that as seriously or understand what you were talking about there. And I understand that after the breach, letters were sent out to all the individuals, but some of these folks who received these letters were skeptical about the letters. I don't know if they were from you or from the company, but they brought these letters to our offices, didn't know if they were legit or if they were junk mail or spam or something like that. Can you share that contact with us, or your understanding of how it was made legitimate to these folks who may or may not have understood how serious and how legitimate this was?
Sure, and Kira, feel free to speak to what we've shared previously, but I would be happy to share our letter and the text of it with each of the General Assembly members, because I actually think you could be helpful in validating that this is the letter from what is that ultimate vendor that Insight Global had contracted to be able to not only perform the notifications, but then also run the hotline whereby the credit monitoring would be offered. For purposes of being responsive to the constituents, I would offer that if they do have any concerns, the number one thing they can do is call that hotline, because that will help give them information about potentially being implicated in any of the data incidents, but also about the credit monitoring that then they will be able to avail themselves of. But Kira, did you have other aspects?
I was just going to offer, I believe that when we originally started sending out the letters, we did provide them the template that we use to members of the General Assembly, but Dave, keep me honest, and if we haven't, it sounds like it's worth a reshare.
And just to follow up on that, we, obviously, I believe that if they came to our office, we were able to say those were legit. It's more about for maybe folks who haven't heard about that yet, or who may be watching today, want to make sure they know that there's a place to a hotline to call. And so I think maybe more advertisement of that hotline would be important. And just finally, how many individuals have actually contacted that hotline asking for assistance? Do you have a number of that?
I believe we do. I will just, if you're okay with it, given that you had mentioned the advertising, if folks are watching today, the hotline number is 1-855-535-1787. And that is the hotline that then folks will be able to access those credit monitoring services. We are happy to partner with the General Assembly, helping to get that message out about that resource and that tool for folks. I believe, Kira, do you have the numbers for access?
I don't have the numbers for the total number of individuals that have called the hotline, although I know we have that, I just don't have it readily available. But in total, as of July 8th, 453 individuals have called the hotline and signed up for credit monitoring services. Again, no financial information was actually disclosed, but in an abundance of caution, we are offering that as industry best practice would dictate.
Okay, thank you both. That's all I have at this point.
Thank you.
Thank you, Senator Hutchinson. If I could follow up on his line of questioning, my understanding was that the previous vendor would call individuals on their list, get the voicemail, and look, I think we all understand this. In the era of spoofing and spam calls, people aren't always likely to pick up. However, I then further read that the latest vendor, Insight Global, had a problem with internet-based phones where they could call out, but they couldn't receive phone calls back when they were doing the contact tracing with the COVID-19 positive individuals. Now, for this credit monitoring services, if over 72,000 Pennsylvanians have been potentially had their personal information exposed, and only 453 have called to avail themselves of those services, is this company using the same type of internet-based phone system, potentially precluding individuals from accessing these services?
Sure. I'm happy to speak to, I think, what, Senator, we shared your concern with the low number, and what we learned is that by way of uptake, on average, this is very aligned with when there are data breaches and credit monitoring services are offered, because I think we felt the same, that felt like a low number comparatively. And so when we were bringing up these questions with data specialists who are much more in the weeds on these topics than we are, this was more aligned with, I think, where they expected to be the uptake rate. With the internet-based phone aspect of it, I want to make sure that we actually have completely accurate responses there. My understanding is that this is a service, and the credit monitoring service is going to be offered by an entity that Insight Global, we asked and forced Insight Global to subcontract with. And so okay. I don't believe that any of the internet-based phone issues would translate then to a subcontractor, but I wouldn't want to speak in complete conclusions without just checking with our team to make sure that that's true. I believe there's too much of a divide there between what Insight Global did and how they performed their operations and the vendor that they brought on to handle the hotline and also do the credit monitoring. But we're happy to check into that.
Okay.
And Senator, I just want to make sure I'm being precise in my language. There are 453 individuals who signed up for the credit monitoring. More have actually called in.
Okay.
And
Very good.
in this instance, we aren't calling people from the hotline number. They have to call in. And so to Acting Secretary Beam's point, we'll get more information for you on the internet-based phone apparatus, but I don't believe that we're experiencing the same issue to date.
And in terms of effectiveness, when you gave those numbers really quickly, just a quick back of the envelope math up here, 180,000 had not been reached after multiple attempts. Over 376,000 had been reached out to in terms of contact tracing. We know that these internet-based phones provided challenges for individuals who wanted to respond back. Is that something that has been addressed in this future contract?
Sure, and also with the support, I want to be clear, with our 877 line, we've been able to also create a channel whereby folks are able to call back, if that is truly at the fundamental piece of this. A lot of our nurses, particularly when they're kicking off that case investigation, they don't want to necessarily leave a phone line that is their phone line specifically, and so we have a concentrated channel that folks can call back into when they have been reached out to by any of our community health nurses, and then the contact tracing service with PCG will allow them to also call back in.
Very good. Thank you. Would like to recognize Senator Robinson, followed by Senator Aument.
Thank you, Madam Chair, and thank you, Secretary Beam and Deputy Secretary Klein-Peter for joining us today. I was just wondering if you wouldn't mind walking the committee members through the contact tracing process from start to finish. For my own peace of mind, if I test positive for COVID-19 and your department gets those results, and then would you relay it to this vendor or relay it to the incoming vendor, et cetera, et cetera?
Sure. So I'll go through high level, and then Kira, whatever I miss, feel free to fill in. So first, when an individual does test positive for COVID-19, a public health professional from the Department of Health, our staff, reaches out and performs the case investigation. That's a more in-depth analysis as to really the status of the patient, understanding their well-being and where they are, but also making sure that we can identify anyone that they could have potentially had that exposure with. And so they actually provide a list of names and phone numbers as a positive case that they believe that they might be aware of having that potential exposure with. Those contacts are given to our contact tracers. And so that's the information that would then be shared with, at this stage, it's being shared with the National Guard. When PCG is onboarded, it will be shared with PCG. Those contact tracers reach out to the close contacts who, just as a reminder, may not be experiencing any symptoms whatsoever. And they alert them that they could have had that potential exposure to someone who has tested positive for COVID-19. The contact tracers don't share the who, they don't actually share the individual that tested positive, but they do allow this individual to be informed that, one, they should be acutely aware of if they develop any symptoms, two, that if they are feeling those symptoms, they should go get tested, three, allowing them to understand the quarantine processes and procedures, and then also allowing them to be able to be skilled enough to check on their symptoms daily for that continuous monitoring. There is an alternative tool that I just want to touch on while we're talking about the contact tracing process, which is our app. The app is more about the individuals that case, that COVID positive case, may never have known that they were around for that limited duration of time and space. And so I think we've used examples of movie theaters and churches. It's when you might have sat around someone or been around them for that minimum amount of time, but you wouldn't have their contact information to actually give the case investigator at that time. And so we use those two tools together to be able to just alert folks that they could have had that potential exposure, allow them to monitor their symptoms on their own, and then be able to proceed with getting a test if necessary. Any other aspect?
I would just add that regardless of who is doing the contact tracing, the process is the same.
Yeah.
So it should really look the same to Pennsylvanians from their user experience perspective.
Sorry. So the data goes to the incoming vendor then? Is that what I'm hearing?
So right now, the data is shared with the National Guard. And then when PCG is onboarded, that contact tracing management system that Kira spoke about will actually be where that data is housed and where they will have access to.
Thank you. Is there any difference in a county that has its own health department when it comes to contact tracing? Is there a duplication of effort in those counties?
It's a really great point, and I should have highlighted it earlier. Our county municipal health departments are actually responsible for the contact tracing in their jurisdictions, and so they likewise are a partner in making sure that they're taking care of the contact tracing within their local jurisdiction. And so the Commonwealth really is responsible for the balance of the state.
Okay, thank you. I have no further questions. Thank you for your time, and yield my time, Madam Chair.
Thank you, Senator Robinson. Senator Ament, followed by Senator Judy Ward.
Thank you, Madam Chair. Just very briefly on a second round, I want to ask you briefly about the information prior to Act 112 being signed into law. I think it was in November. This past November, the information that was available to our first responders as compared to the information that was available to Insight Global. Certainly I, and I'm sure many of my colleagues, heard frustration prior to the legislation last year, frustration that was expressed by our first responders responding to calls but not being able to access information as to whether or not an individual that they were picking up was COVID positive. Yet certainly through the contact tracing program, Insight Global was able to access information. The contact tracers that they had employed was able to access that information and more prior to Act 112 being signed into law. Can you sort of walk us through that, how that was, that the distinction between the authority granted to Insight Global and the authority that our first responders did not have?
Sure, I am happy to start, and if you would like, I believe our team should probably provide more than what I have today on that front, because I want to speak with complete accuracy in what I understand. We were able to share data with Insight Global by way of us using contact tracing as our public health tool. I believe the EMS workforce and those providers, and we worked very closely with PIMA and Director Padfield in understanding how the dissemination of any of our COVID positive information would be shared with any of those potential first responders, because we understood their concerns in being able to show up at a site and understand who was potentially COVID-19 positive and wasn't. With that being said, I think it's probably best that I actually have the team follow up with you about the progression of information being shared with first responders throughout the fall prior to that act, so that that doesn't get confounded with really what was separate and apart, us working on making sure we were doing the contact tracing.
Thank you. I appreciate that. Thank you, Madam Chair.
Absolutely.
Thank you, Senator Ament. Senator Judy Ward, followed by Senator Dush.
Thank you, Madam Chair. So you also have a new emergency procurement contract with Ginkgo Bioworks for COVID-19 testing in K through 12 schools. As Vice Chair of the Education Committee in the Senate, I do have some questions on that. Will schools be required to engage in this, and would it only be public schools? Can you share?
Absolutely. And so thank you for bringing that one up. As preparation for our school year, and really in an effort to allow us to have as much in-person instruction as possible this fall, the federal government granted states the finances to be able to set up these school testing programs. And so, again, given that the financial support is coming in May and June, and we're talking about a program that needs to be ready to be implemented by August for our school year, we worked on actually having an emergency procurement to be able to have these services accessible for students and teachers when the 2021-2022 school year kicked off. And Ginkgo is actually our partner in being able to deliver really what is a comprehensive service by way of testing and also providing the staff to assist with that testing. At this stage, it is not mandatory participation, and so the schools will be able to elect into it. But Kira, I think you have more detail on that specific EP.
Yep, absolutely. So the vendor has actually not started work yet, unfortunately. I think to the point of how it can take a little bit of time to get these pieces in place. And so I was asked yesterday, why did you do an EP for this when the school year, you still have a month? But it takes time to get these contracts appropriately in place so that the vendor can actually begin work. And so they haven't begun work yet because we are still trying to finalize that contract. As soon as that agreement is signed, though, we're planning to schedule joint meetings between DOH, Ginkgo, and external stakeholders to introduce the program to them. We're going to send correspondence to the schools through the Pennsylvania Department of Education, which will include instructions on how schools can opt in. The opt-in process will involve the schools signing a statement of assurance so to ensure that they understand how to protect PHI and PII. And we're happy to keep all of you updated as soon as we finalize that agreement.
Would school nurses be doing the testing?
No, so this is actually kind of a comprehensive service that's going to be provided to the schools. That was one of the reasons why we ended up choosing Ginkgo. There aren't many vendors who can do, the full suite of activities required in testing.
And you mentioned that the federal government's going to be, are they covering all of this or part of it, or what is the cost?
They are covering all of it. This is, again, we are grateful for the financial resources, but we also understand that it is our responsibility to then execute upon getting the right partners under contract. And so as Kira indicated, we are now, I think, dutifully hustling to be able to have this program up and running for this school year. And you mentioned school nurses, again, another part of our public health workforce that has just been, I think, had a tumultuous past year, and frankly, past 2 school years, if you consider the end of the 2020 school year. And I think that one of the pieces of this package that Ginkgo provides that is helpful is where wanted, where there's a school nurse that needs assistance, this is comprehensive staffing to help support a testing infrastructure that I think could potentially be seen as additional strain on school nurses that they might not need right now. And so this will be something that hopefully will allow us to, again, perpetuate in-person instruction to all extent feasible, but also have that testing readily available for both our staff and our students to get on top of any of those potential outbreaks.
Great, thank you so much.
Thank you, Senator Ward. And just a comment and a concern. And that is that the personal data of our children is very sensitive, like everyone's personal information. However, great damage can be done when a child's personal information is compromised. So often we hear that an individual will go apply for a college student loan, a first car loan, and realize that their data was compromised many years prior. And because that individual isn't active in the marketplace, taking out loans, applying for credit cards until they turn 18, a lot of damage can be done in that time. So protecting our students' personal information is really essential. And while this committee has not yet had the opportunity to vet that contract, believe that it is very much imperative to assure and safeguard that information. So recognize Senator Dush, followed by Senator Brooks.
Thank you, Chairman. The Department of Health testified last summer before the Communications and Technology Committee about the development of the smartphone apps. I'm curious, with Apple and Google, we see that the notification to download the app on the smartphones is there. How much, two parts to this question, how much collaboration's been going on between the department and those two vendors? And also, do Apple and Google have access to the information independently as a business?
Sure. So I will speak to a bit of the aspect of the collaboration. So just by way of Google and Apple being able to be the platform on which the app is actually used, but Nearform was actually the developer of the app.
Right.
Nearform, similar to other processes that we've spoke about today, there were many vendors coming to us with app potentials. And what the ultimate value add is being able to understand when you may have had that potential exposure, even though the person that you had the exposure from doesn't have your contact information, and being able to just alert people to be aware of it. Nearform had demonstrated success over actually internationally, and we were able to say, can we bring that to Pennsylvania with those heightened privacy safeguards? Because we knew that that was going to be a key aspect of the app's success here, that to the extent that folks weren't necessarily able to trust the confidentiality of the data being collected, that they likely weren't going to download the app. And that, in course, would not allow it to be as effective as possible. The app is built upon a technology that has no GPS, no understanding of the location of the individual. It is simply a Bluetooth and its proximity. And so in being able to have an app that really did not do any sort of tracking of an individual, we were able to collaborate with Nearform to then be able to, I think, have a very successful uptake of our app here in Pennsylvania comparatively, because folks were able to trust that information. Google and Apple, by way of the data collection, I believe that there is de-identified aggregate data collection that takes place at the state level. I don't know specific to Google and Apple. Do you have that?
I don't believe that they receive the data, but we can confirm that. We receive, as Acting Secretary Beam mentioned, anonymized aggregate data so that we can assess the app's performance and to identify, what if there are new symptoms emerging, but otherwise the data is not shared further.
I have a concern because the IP address both that identifies with the Bluetooth devices as well as making the connections could end up being linked, and that poses a potential for both Apple and Google to collect that information and be able to use that for corporate purposes, which I'm very much concerned with, because that falls outside the scope of what we're trying to do with it. I would appreciate it if you guys could follow up and find out if in fact there is that connection between the two, and if so, what's Apple and Google's ability to utilize that information for corporate purposes.
If you don't mind, Senator, just two quick facts on that, and again, happy to have a more in-depth follow-up. And I think practically speaking, our app team would likely be it sounds like you have the level of expertise on data that you will likely be able to have a more informative conversation with them. But just by way of speaking to why Nearform emerged as one of the, as the finalist, it was really the entity that we also knew could not profit and would not profit off of anything oriented towards this app. That was a characteristic of the different vendors that were pitching products to us, that we did not want anyone that could potentially have any monetization of this data take place. Secondarily, on the IP address, and again, this is where likely a more technical discussion is warranted, the way that the actual alert takes place is that, and having had firsthand experience with this, is that you receive the pop-up notification that says you have a potential exposure. It then really steps you through what you as an individual can invoke as your next steps. There's no reporting to anywhere, there's nothing being done other than educating you. And in next steps, of course, it's watching your symptoms, of course, it's the potential to get tested. But if you have questions, you are then given the opportunity to give your phone number to the app to then have somebody reach out to you, likely one of our clinicians that can help step you through, I think, mental peace of mind of what's taking place, what this really means, and the like. It's my understanding that that is the only point at which an IP address comes back to our systems whatsoever, and immediately upon receiving that phone number, it is deleted. And so I offer that that was also a primary piece of the deliberation around picking near form, was understanding that we would not necessarily have that information retained for any amount of time, because frankly, I don't believe we wanted to retain that information for any amount of time. And so that, again, limited exposure to the app's development and knowing the critical nature of not just the Department of Health, but the administration, with making sure that the success of the app was contingent on folks not feeling like this was something that was going to be invasive, but rather was just a helpful tool. And so we struck that balance and procured with near form.
I appreciate the information with near form. My concern, again, and it's not just the IP address, but the SIM cards and stuff that are uniquely identifiable to the phones. Google, Apple, they have all that information, and when those things start communicating data back and forth, I think there is a potential there, and I would just appreciate as a follow-up that you would contact and make sure that they are not using that, and that there are safeguards in place to prevent them from doing it. Getting back to the prior contractor, the information that was posted out on Google Docs that was not authorized to be out there, do we know yet whether or not that information has been scrubbed from Google Docs or not?
Yes, so part of our immediate swift intervention at all times is pulling down any potential access to those Google Docs. And so, again, I don't believe I know how much I can speak to here, but that we are not aware of any Google Doc that continues to exist with any sort of access from former employees of Insight Global that have publicly identifiable Pennsylvanians information on them.
Has Google been contacted and asked to ensure that this was scrubbed?
I know that Google has been contacted. I want to make sure that, again, their response is also something that we can speak to. We cannot. I apologize.
I understand the legal aspects, but I do want to make sure that these things are followed up on.
Thank you.
Lastly, Executive Deputy, you had said about you'd compared measles to this, and when I'm looking at death rates of 1 or 2 out of every 1,000 with the measles, as compared to what the mortality rates is with this and the flu, the similarities between, I think a better comparison would have been to the flu versus COVID versus measles. There's a marked increase in the death rates, a massive order of magnitude increase on mortality rates with measles. So if it was measles that we were having this discussion about, absolutely, I think there would be reason for widespread concern, and there is for this. I'm not minimizing the any death that's impacted by this is it's tragedy, but there is a difference between that. I would have appreciated something more along the lines of with the flu, which has a similar mortality rate. But thank you.
Thank you, Senator Dush. As a follow-up to the conversation on the app, when an individual is identified as having COVID, is any information from that app then handed over to the state's contact tracer?
So it's actually that when you are, the way that the Department of Health finds out about a positive case is our testing, right? So it's you get the positive test, and then an individual is contacted as that part of that case investigation. When you're in the case investigation, they'll ask you, do you have this app on your phone? If you do, go and enter this 6-digit code, and then that will allow your phone to basically alert the potential individuals that also were carrying a phone with that app, that were within your proximity for the minimum amount of time and within that 6-foot distance, to let them know that they're the potential exposure. And so it's a proactive tool that an individual can use to then help alert those that they might not have the contact information for, rather than it's an app that feeds back to any of our contact tracing management systems.
So no data or information goes from the app back to the department's contact tracer?
Correct.
Very good.
And
Thank
Senator,
you.
if I could just add, in the spirit of transparency for those watching at home, if you have not downloaded the app, if Acting Secretary Beam had it on her phone and I didn't have it on mine, her phone couldn't detect any information from my phone if I didn't have the app. So I just want to make it really abundantly clear that both parties have to have the app, and that's why we think it's so important to download the app for all Pennsylvanians. But if you don't have the app on your phone, no information can be exchanged.
I appreciate that. Thank you very much. Senator Brooks.
Thank you very much. Just touching very quickly on the credit reports. Did the department reach out to the reporting agencies that there are folks that may be requesting a credit report so that, you know, the people on the street, they have an ease to get those credit reports? I know sometimes it's not always easy to obtain those free credit reports. So did you reach out proactively to say, hey, this is what occurred in the state of Pennsylvania and this is what may happen, and so that it's easier for people to achieve or to receive those free credit reports?
Sure. So, Senator, if I understand correctly, so in order to facilitate individuals whose information was compromised as a result of the Insight Global data incident, we mailed letters to those 76,000 individuals. And in that letter was contained the hotline number that they need to call to understand, to confirm that they have been implicated, and then to obtain that free credit monitoring. So that was something we required Insight Global to obtain that service, which the hotline will be active through the end of September 2021, and that credit monitoring is good for a year, I believe.
But my question was, did the department reach out to, I think there's 3 main credit agencies.
Oh, sorry.
Did the department reach out to say, this is legitimate, yes, they have that letter, and we're asking for you to work with these people and make it easier to obtain those credit reports? Did the department reach out?
Understood, Senator. So what we want to actually have people do is not necessarily go get their own credit report from Experian or the other companies that actually offer that credit monitoring. We would like them to actually enroll in this so that it's free credit monitoring provided by Insight Global's sub-vendor. But I don't believe we actually did proactive outreach to the main companies that do credit reporting. We're happy to do that just to allow them to understand what happened in Pennsylvania, but that was not previously done because the credit reporting is, in my mind, something that individuals would go and invoke themselves, and we would want to make sure this is done in a covered way and free through the credit monitoring provided by Insight Global.
Since Insight Global had the data breach, what safeguards with their subcontractor do we have dealing with credit reports?
So again, by way of industry best practices, we were able to understand that really it is for Insight Global to hold that vendor accountable, but the vendor is very separate. The credit monitoring vendor is very separate and apart from anything that Insight Global has by way of data protection and data security. And so this is another business that really actually has the reputation for being the entity that you bring in to allow there to be access to credit monitoring services. And they'll of course be held to the same expectations of data privacy and security. But I do want to separate out the data practices of Insight Global should not in any way, and frankly should only heighten the need for that subcontractor to again keep that information private.
And I fully understand that financial information wasn't not involved in the data breach. I think that's important that we do continue to repeat that. But how then did we validate that the credit company that they're using is legitimate? Did we do our research on that?
So we, again, knowing that we needed bench strength on this issue, brought in not just outside counsel, but actually outside experts on forensic analysis and understanding what to do by way of any sort of response to a data incident. those individuals were who helped us understand better that credit monitoring process, and the company that then was going to be brought on board, again, paid for by Insight Global, but really they are a separate entity responsible for doing the credit monitoring, running the hotline and the like. And so it's their judgment that I think we relied upon as a recommendation, that they felt that that company was one that had demonstrated success and experience in this field, that we would then entrust Pennsylvanians into calling that hotline and getting those services.
Okay. I think it's important then to point that out as you did, because I think, we ambiguously throw out credit reports and that, but they actually have to contact that number, to receive that service. Okay.
Yeah, Senator, we're happy to partner with, I think, again, the members of the General Assembly may be some of our best kind of allies in making sure that that number is publicized into your communities and that folks know that the resource is there. And so we can work with our Director of Legislative Affairs and the like to talk through how we should be pushing out more proactively the access to the credit monitoring, but those services, by the way, the hotline and the like.
Okay, thank you very much. Regarding the new EP with Ginkgo, just to follow up to Senator Ward's questions, when we found the EP on the e-marketplace on around July 8th, it was just shy of, I think, 181 million. Is that correct?
Correct.
But I think as of yesterday, the EP online now says the contract is roughly 87 million. Can you just elaborate on what the difference is? Just such a significant change, and most certainly we're thrilled that it's less, but just, what was the change?
Do you want to speak to it?
Sure. So thanks for that question, Senator. We did end up revising that emergency procurement because based on some revised protocols and controls that we put in place within the department, upon further consideration and subsequent negotiation with the vendor, we determined that that ceiling was too high. And so we did reduce the emergency procurement amount to be more aligned with, again, a ceiling that seems to be more commensurate with a, again, worst case scenario that we would have to use that amount of funding. But that seemed, upon further reflection and negotiation with the vendor, to be a more prudent use of resources.
Okay, thank you very much. Final question is, we have over a year, roughly 16 months of data, experience, lessons learned behind us. Understanding there are differences with the variants, you've hopefully worked out some of the kinks with the dashboard with more accurate, up-to-date information. How to best perhaps roll out the vaccine and include using our local community pharmacies. I'll add that. Providers being required to administer 80% of the distribution that they receive within the first 7 days, which I believe that was the pivotal moment that we saw the dramatic change in vaccination rates. And Secretary Beam, you and I have had that conversation early before, that decision was made. When, Joan, my executive director, and I had gone through the spreadsheets and had seen that the vaccines weren't being distributed or administered quickly. And so, I will always be grateful with you working with me to drive those vaccines out quicker. So learning these things as well as much more, moving forward regarding contracts, do you envision the need to continue to only use emergency contracts? Or is there a way that we could adapt something in the middle? A difference between emergency contracts and the actual procurement process, shorten it a little bit, but put more transparency, more input, and more accountability into the process.
So just to build off of that, Senator, the traditional procurement process is something that we have great respect for. It is not something to escape. And we've had a lot of really helpful conversations with the Department of General Services about why the traditional procurement process in Pennsylvania is as thorough as it is. And I think as Secretary Topper testified to yesterday, why there is as much scrutiny and as much rigor paid to it as there is. The reason that we invoke emergency procurements when it comes down to the fundamentals is time. That there are typically urgent circumstances where either lives are on the line or, frankly, as some of the procurements that we've alluded to today, programmatically things need to be stood up more quickly than the traditional procurement route would allow for, that we have invoked the emergency procurement. In our mind, that is always the exception. The norm is traditional procurement because of the integrity that comes with the traditional procurement route. And so I know Executive Deputy Secretary Klein-Peter spoke to internal controls that we've put in place to make sure our team also feels this way, that the way the program areas should always orient themselves is towards a traditional procurement, but for in these exceptional circumstances where there are such compelling reasons. We've put in place now the processes by which there is, again, the scrutiny paid by leadership to make sure that that's actually happening. But ultimately, the way that we can differentiate and really get back more oriented towards a traditional procurement is remove those urgent and, frankly, life-losing circumstances. And so I think as we come out of a pandemic, and hopefully the Commonwealth continues to progress in the direction where we are not necessarily having the loss of life at the level at which we're having it right now, those circumstances will be alleviated on their own, and traditional procurement will be what emerges as our consistent default. And as Executive Deputy Secretary Klein-Peter said previously, there have been years when the Department of Health did not invoke one emergency procurement. That's the norm, right? And so I hope that we're in a direction, again, that the pandemic's urgent circumstances and truly lives on the line circumstances are being removed so that we don't necessarily even have the justification to go the emergency procurement route, and we continue to invoke the traditional procurement route, which is our standard.
Thank you for that. If there is something that we could meet in the middle that allows you the expediency of an emergency contract, but not as long as a normal procurement, something meeting in the middle that helps you meet that deadline, but yet puts a few things in place. That was my question. I didn't know if there was something that the General Assembly could be working on now, so that when we go back in the fall, or even if we had to go back sooner to vote on it, that there's a middle of the road procurement process that perhaps shines a little more light, gives a little more competition in the process, but yet isn't as lengthy as a normal, only for this snapshot in time, not using it perpetually, but only for this point in time. That's my question. Just wondering if somehow there's a way to meet, in the middle of the road.
Sure. So I appreciate that question. And let me share two perhaps insights with you, Senator Brooks, and I wouldn't presuppose to tell the General Assembly what to do, but let me share a couple things and then happy to have, a creative dialogue with you. So the first is Secretary Topper testified yesterday that DGS is really focused on reducing the cycle times for an RFA. So right now an RFA can take anywhere from 3 to 12 or more months. And so he's really focused on finding ways to make that a more efficient process so that the time isn't a deterrent for agencies, right? And so I think that's an area where I would encourage us to bring DGS into the conversation, because from an agency perspective, I'll say, 12 months to bring in supports, even in a non-emergent situation, can be quite onerous. So that's the first insight I would provide. The second is sort of to your point around what is a middle ground. So the emergency procurements that I've been involved in while they haven't been as full-blown as an RFA or a bid, we don't go in blindly and just take a single proposal that is given to us. The ones that I've been involved in, we've actually received anywhere between 2 and 6 proposals that we have evaluated based on standard criteria that is evaluated in advance of reviewing the proposal. We have committees internally who review and vet those and make a determination of best value based on what the vendor is bringing to the table and what that cost is. And so I think it's important to highlight that DGS, if they don't explicitly, they do implicitly require us to get more than one proposal so that we aren't simply, taking something blindly, but rather we are evaluating other options. So that's something we do right now. I would certainly be interested in your thoughts of how we can build upon that process to make it an even better middle ground, but that's how we operate today.
All right. Well, thank you for, adding that. The whole point of this hearing was emergency contracts. And so, taking something away from this hearing, I think was important on how do we move forward. So I want to thank you, Kira, for your thoughts. Acting Secretary Beam, I know that you have not been through this whole process. I think many of us felt you were refreshing to work with, and you tried to be more of a partner and communicate with us. And Dave Toth in the back, I also want to thank him for everything he's done. It truly has been a challenging year, and I think we're looking for partnerships on how can we do this better if we're faced with something in the fall. That's my goal, and how can we partner? How can we do it together, learn from the missteps, and move forward for the people of Pennsylvania? So I want to thank all three of you, as well as the department, for everything you've done, and look forward to continuing to work with you.
Thanks, Senator. That means a lot. You are a partner in collaboration pretty often, and so we appreciate the kind words and, of course, the recognition of the team that has truly been front lines on all of this. Thank you.
Thank you, Senator Brooks. And one quick follow-up conversation. Earlier in your testimony, you indicated that you had consulted with experts with regard to data privacy and cybersecurity for this new contract. You didn't specifically reference who those entities were. So was anyone within the Office of Administration, including our Chief Information Officer, our Chief Information Security Officer, our Chief Technology Officer, were any of those individuals tasked with reviewing the contract and the vendor with regard to the vendor's ability to handle sensitive healthcare information?
Sure. I hope that they wouldn't mind me sharing this, but the one thing about Executive Deputy Secretary Klein-Peter and I is that we know what we know, we know what we don't know. And when we realized that the data breach was going to be of just utmost importance, we assimilated the right expertise within the Commonwealth, because we do have chief privacy officers, we do have chief information officers, we have our own Bureau of IT services that frankly are way better versed in something like a data incident than we are, and they have experience responding to them. They know what Pennsylvanians should be ready to expect, and I think that assimilation of that team within moments of us finding out about the data incident really has been what has put us on a better track for being responsive to this. So I offered their names, but also with a bit of gratitude here, because they helped us really take what was something that felt a little foreign to us and allowed us to become not only educated in it so that we could make strategic decisions about the response, but they also helped us through being extremely swift and making the right team choices of who was going to help us and inform our decision-making, project management-wise and the like. And so that expertise was absolutely tapped into immediately upon us learning about the data incident.
And this was a different approach than when initially making the decision with regard to the prior contractor.
I want to be clear on making sure I understand if there was any use of OAIT or others when Insight Global was initially vetted. I don't know that if there was involvement, but I'm happy to check with folks that would have that historical knowledge.
I'd appreciate that. Thank you. I'm going to turn it over to Chairman Kane for some closing remarks.
Thank you, Madam Chair, and I'll keep my closing remarks brief, but I just wanted to thank the acting secretary, for all your hard work, and also Deputy Secretary Klein-Peter for all your hard work also. But we can't forget the Department of Health and your entire staff for the past 17 months plus for their extremely hard work over this past year. I don't think anybody saw this pandemic coming, and thank you for all your help there. I also want to remind everybody that vaccines are the best way to keep the spread of COVID and, keeping our friends, our families, and our community safe. So I urge anyone out there, if you haven't received your vaccine yet, please get your vaccine. With that, Madam Chair, thank you so much.
Thank you, Chairman Kane. And I, too, would like to thank both Acting Secretary Beam and Executive Deputy Secretary Klein-Peter. I almost think we should call you EDS.
Yes.
That title's it's almost as long as my last name. So yes, but thank you. I appreciate your testimony here today very much. And I think that my key takeaway from our lengthy conversation today is that we have an opportunity to work collaboratively. The executive branch, the legislative branch, and that we have an opportunity through collaboration to first rebuild trust in the Commonwealth, to assure data privacy, the protection of very sensitive personal information of the people of this Commonwealth, and that we can improve transparency and address challenges not only in our emergency procurement process, but also in our procurement process as a whole. So I, again, want to thank you for the conversation today and thank everyone who attended and tuned in. And I now recess this joint public hearing of the Senate Communications and Technology Committee and the Senate Health and Human Services Committee to the call of the chairs. Thank you.